There are certain ailments one expects as an unfortunate consequence of getting older. For men, frequent late-night trips to the bathroom and an increased risk of prostate cancer are regarded as inevitable aspects of aging, with treatments ranging from medication to invasive and debilitating surgery. But what if prostate enlargement and cancer could be prevented and even reversed? What if what your doctor isn't telling you could save your life? Hi, it's Emily from Bite Size Vegan, and welcome to another Vegan Nugget. Despite the serious complications and even fatal outcomes, the topic of prostate health is rarely addressed in an appropriate, constructive, or respectful manner. With an astounding array of prostate-themed jokes poking fun at increased urination and the horrors of rectal exams, an enlarged prostate seems more like a rite of passage into infirmity than a medical condition. And with heaps of supplement scams, prescription-pushing physicians, and scalpel-wielding surgeons, it's hard to know what information or approach to trust. In this fourth installment of the Men's Health series with Dr. Greger of nutritionfacts.org, we're going to see what the science says about preventing, treating, and reversing prostate cancer and benign prostatic hyperplasia, BPH, the medical term for the non-cancerous enlargement of the prostate. If you've seen the first 3 installments on testosterone, erectile dysfunction, and soy's effects on hormones, you'll notice a common theme of the medical profession: ignoring simple and effective treatment in favor of ineffective and debilitating measures. Prostate surgery, the various methodologies of which read like a list of medieval torture practices, can leave men with ongoing erectile dysfunction and urinary incontinence issues, among other side effects. Let's take a quick look at what 2 of the leading institutions have to offer. In regards to benign prostatic hyperplasia and prostate cancer, respectively, the American Urological Association and National Cancer Institute do have a cursory nod to the effects of exercise and diet on prostate health, but fail to expand upon what that means in practical terms. If we look at the AUA's extensive guidelines for BPH treatment, there is watchful waiting, essentially meaning let's just see what happens, during which period no recommendations are made for dietary intervention. And then there are medical therapies, meaning drugs, which receive 7 pages of prescription possibilities. A potentially promising section on alternatives only addresses dietary supplements, and surgical procedures shine with a 6-page spread. Perhaps the worst offender is the AUA's Prostate Health Playbook, in which they attempt to convey this misinformation through strained football analogies in an astoundingly patronizing and condescending manner, as if possession of a prostate renders one borderline incompetent, requiring spoon-fed sports comparisons for basic comprehension. The information Dr. Greger is going to provide can spare you the pain of the devastating effects of potentially unnecessary surgery, and even save your life. And the fact that you'll never hear this from your doctor is why you should be pissed about your prostate. So prostate health is a huge concern for men. What we usually hear most of is enlarged prostate, prostate cancer. The way that these are presented, though, by the medical field, it seems like they're almost inevitable aspects of aging. Can prostate cancer and an enlarged prostate be prevented, and how so?
Some of the most compelling data for eating healthy for both men and women has come out of Dr. Dean Ornish's lab, who first showed that we could first to do a randomized controlled trial showing that indeed heart disease could be reversed with a plant-based diet and other healthy lifestyle behaviors, opening up arteries without drugs, without surgery. And so after conquering killer number 1, he's like, okay, next, and went on to killer number 2, cancer. And took men with prostate cancer, put them on a plant-based diet, same kind of regimen, and actually got a reversal in the growth of early-stage prostate cancer. And indeed, it's interesting, when you take serum, when you take blood from men who've been on a plant-based diet for a year and drip them on cancer cells growing in a petri dish, they suppress the growth of that cancer about 8 times better compared to the blood of men eating the standard American diet. What's interesting is that then a different group of researchers said, well, wait a second, I wonder if the same effect could have on the growth of normal prostate cells. So they did the same experiment and found that indeed, you go on a plant-based diet, and this time it was just a diet without the exercise or stress management components. If you go on a plant-based diet, your blood indeed is better able to suppress the growth of your normal prostate cells. And I talk about in the video, indeed, this kind of that's just kind of an inevitable consequence of aging. You get older, your prostate enlarges. No, that's an inevitable consequence of eating a standard American diet and aging. So I talk about statistics in the United States. It affects, so enlarged prostate. And when I say enlarged prostate, what does that mean? Well, it kind of squeezes off the urethra where the urine goes through. And so you have to frequently get up at night a couple times because you can't, you have this kind of weak, hesitant urine stream. And so you can't completely evacuate your bladder. And so then your bladder fills up over and over again. Anyway, and then it's this stagnant pool of urine. You get more likely to be infected. 50% of men in their 50s are affected. 80% of their men in the 80s. It's an epidemic. The United States, we're talking about 16 million American men. $1 billion a year is spent on drugs to treat it, another billion on supplements, lots of surgery. And the reason we know that it's not an inevitable consequence of aging is because you can look at different populations around the globe. So, for example, in China, there was a study at the Medical College of Beijing. They didn't have 80% of men infected. They found 80 cases, period. 84 cases over a 15-year period. It was such a rare, it was considered kind of a rare condition until, of course, China started eating like us. There are particular foods that appear to help. Garlic and onions, allium family vegetables. Cooked vegetables appear to work better than raw, and legumes, beans, split peas, chickpeas, and lentils, as well as flax seeds. And there's actually head-to-head challenges of ground flax seeds versus the leading drug prescribed for BPH patients, and it worked just as well as the drug without the side effects. A group of critical researchers showed it's not just these individual plant foods, but if you go on an entirely plant-based diet, you can dramatically slow down the growth of these prostate cancer cells so you don't have to deal with this as one gets older.
I hope you found what Dr. Greger shared to be helpful and eye-opening. On a personal level, when researching for this video, I did not at all expect to get so angry about prostates. But the more I looked into the studies so graciously compiled by Dr. Greger and compared their data to the guidelines of major medical organizations, the more angry I became. Everyone deserves to be fully informed about their health and offered all of the possible treatments. As long as doctors present BPH and prostate cancer risk as just a part of aging and fail to alert their patients to effective, non-invasive methods of prevention and reversal, countless men will continue to undergo unnecessary surgery and even lose their lives. For more on why your doctor is lying to you, please see this video here with Dr. Greger, and refer to the blog post for this video linked below for more information and links to Dr. Greger's extensive content on prostate health, including more about which foods to avoid and include in your diet, and his New York Times bestseller, How Not to Die, which includes an entire chapter on prostate health. To make sure you're getting the prostate healthy nutrition you need, I wanted to let you know about Chronometer. It's a free website and app that I've used in several of my videos because of its uniquely detailed nutrition reports and ease of use. Plus, they've reached out to help sponsor the Men's Health series to get this vital educational information out to those who need it. Click the link in the description or go here to make your free profile. Please share this video around to help men take hold of their health. Be sure to subscribe to the channel to not miss out on the rest of the Men's Health series. To support free education like this, please see the support links below or click the Nugget Army icon or the link in the sidebar. Now go live vegan, get pissed about your prostate, and I'll see you soon.
So even though vegan men tend to have significantly higher levels of testosterone than both vegetarians or meat eaters, which actually can promote the growth of prostate cancer. But the reason a vegan diet can actually reverse the progression of cancer may be because of how low their IGF-1 levels are. So high testosterone, but still low cancer. The bottom line is that male or female, right? Just eating a vegetarian diet did not seem to cut it, right? Didn't do your body many favors. Looks like to get that significant drop in that cancer-promoting growth hormone levels, one really has to move towards eliminating animal products altogether.